Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
Validated and reliable instruments are an important part of assessment for both clinical practice and research in mental health. Which of the following tools is currently considered the standard for assessing clinical outcomes in treatment studies of schizophrenia? A, the Structured Clinical Interview for DSM Disorders, or SCID. B, the Brief Psychiatric Rating Scale, BPRS. C, the Positive and Negative Symptoms of Schizophrenia Scale, known as PANSS, P-A-N-S-S. Or D, the Hamilton Depression Rating Scale, also known as the HAM-D scale. Which of those tools is currently considered the standard for assessing clinical outcomes in treatment studies of schizophrenia? This is a good question, not because you are expected to intimately know every question and every scoring schema of every validated tool out there. I'm sure that all of you know that validated and reliable instruments in mental health are exceedingly important because they really are one of our most important ways of validating our clinical assessments and clinical findings. Unlike general medical practice, where we can do CAT scans and metabolic panels and CBCs and EKGs and spirometry and all of those other objective diagnostic studies, we are much, much more limited in terms of objective validated tools for supporting a clinical impression or clinical diagnoses. And as a result, a number of validated and reliable tools have been developed and studied and published in the literature for us. So while you don't need to know everything about every single tool, you do want to be familiar with the biggies, the commonly encountered ones, at least just a basic understanding of what they are and what they do. And so all of these tools are important in the world of mental health. They're all tools that you should be familiar with, even if you don't use them all necessarily in the day-to-day. And so this question is a good opportunity to review several of these common scales. And then the other part of this question that's really helpful is that it demonstrates the importance of actually reading the question and answering what is asked of you. So first, let's take a look at the scales. So first up is choice A is the SCID, Structured Clinical Interview for DSM Disorders. SCID and the SCIDs, they are analogous to whichever DSM is currently in use. So we have, we had a SCID 4, we had a SCID 5, and now we have a SCID 5. We have a SCID 5 research version. We have a SCID 5 clinical version. So the SCID really is exactly what the name implies. It's the Structured Clinical Interview for DSM Disorders. It's not a scale in the way that we think of, here's X number of questions, rate your symptoms on a numerical scale of 1 to 10, and then we total up your points and get an impression. The SCID is much more involved in that, and it is not the answer to this question. The SCID 5, like I said, it comes in a research version, it comes in a clinician version, it comes in a clinical trials version, and it really is truly a structured approach to interviews. For instance, if a patient evidenced some symptoms or a particular tool, like maybe the HAM-D, a depression scale, or the PHQ-9, or some of those scales that you're familiar with, suggest a particular diagnosis, the SCID then offers an enhanced, semi-structured approach to interviewing the patient to validating your clinical impression. So SCID 5 is not a single tool or questionnaire. It is actually in booklet form and is structured clinical interviews. And so, because there's a clinician version, it might be something that you might find useful, especially early in your practice, to help you structure your interview. However, it's not the best answer to this question because this question is asking you very specifically about which of the following tools are an important part of assessment for both clinical practice and research for assessing clinical outcomes in treatment studies. So the question is very specific to which of the following tools is currently considered the standard for assessing clinical outcomes in treatment studies. And that's not the SCID. The SCID really helps you develop your interview. All right, number 2, or B rather, option B is the brief psychiatric rating scale. The brief psychiatric rating scale is that 18-point scale that is very often used in the clinical context. Clinicians use it. It has these 18 areas of assessment: somatic concerns, anxiety, emotional withdrawal, conceptual disorganization, guilt, tension, mannerisms and posturing, grandiosity, depression, hostility, suspiciousness. I didn't mean to recite the list, but I guess now that I'm almost finished, hallucinations, motor retardation, uncooperativeness, unusual thought content, blunted affect, excitement, and disorientation. So I just recite that list again to reinforce that this is more of an assessment tool, and probably when it comes to psychotic symptoms, one of the best options that are listed here, but you have to go back to the question. The question specifically says, which of the following tools is currently considered the standard for assessing clinical outcomes in treatment studies of schizophrenia? And that would be C, the PANSS scale, positive and negative symptoms of schizophrenia. The PANSS scale is really considered the gold standard for this purpose. It's not something that you would customarily use in your day-to-day clinical practice. It's much more involved in that. It really is about, its primarily utility is really in about evaluating clinical outcomes for treatment studies. So to that end, you'd probably call it more of a research tool than a clinical tool. And so if you answer very specifically the question that is asked of you, C would be the best answer. And the HAM-D is not a scale that we use in schizophrenia. The HAM-D is the Hamilton Depression Rating Scale. This is another scale that you may use in your clinical practice in trying to quantify or validate your diagnosis of depression. Not unlike the PHQ-9, the Patient Health Questionnaire 9, that has become so widely recognized and commonly used. The Hamilton Depression Rating Scale, or the HAM-D, it also evaluates a variety of symptoms or a variety of symptom domains. There's more of them. The HAM-D, now I should know this off the top of my head, I believe it's 17 separate areas that are assessed, and it's a numerical score, and you get X number of points, and that helps quantify your depression. So helpful to review all of these tools, and I'm glad we had an opportunity to do it. Again, I don't think you have to know every nuance. I mean, I don't, and I've passed my psych mental health NP boards, but you do want to have a familiarity with the common important tools out there, and this was a good opportunity for that. And of equal importance when you're taking your boards, you want to read the question in its entirety and answer what is asked of you. If you find yourself struggling, if you look at this and say, well, geez, maybe it could be A or B or like whatever, go back and read precisely what it is asking of you. And that's what tells the story here.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.